All right, so let's now move on to this test and see how it performs in men and women. This is overall. What we're looking at is in the validation subgroup, so you're looking at 526 patients, and we're looking at the cases. So these are absence of obstructive coronary disease. These are cases with obstructive coronary disease, lumped into the three categories that I told you. So low risk, intermediate risk, and high risk. And what this is showing you is that at the low risk, you can actually exclude more patients with this test than you can certainly with a myocardial perfusion imaging. Overall, the negative predictive value of this test is 83%, much higher than what we saw with the MPIs. If, on the other hand, you come back with a positive test, so it's a high-risk group, you can see that you're detecting CAD, or the positive predictive value is high, 60%. So looking specifically at the negative predictive value and comparing it, MPI to the chorus CAD, you can see in the male patient population, you've got a slight increase in the negative predictive value. So this is the ability to exclude disease, which is what you want. It increases from 74% to 76%. By C statistic or ROC analysis, you can see that the C statistic does increase. But fascinating, again, in this gender-specific diagnostic test, you can see that the negative predictive value increases from 75% to 84%. That's a big increment. And if you look at the C statistic, you're going from 0.48 to 0.65. Again, much more powerful at excluding coronary disease in the female patients than the male patients. Now, this is an interesting way of looking at it. If you are, and again, we're looking at the PREDICT trial, but if you have the combination of MPI now and the chorus CAD, what is the ability of this chorus CAD test to reclassify patients appropriately? And this is what we're looking at. So basically, you're looking at here at the female patient population. These frequencies here are the percentage of patients with obstructive coronary disease. Okay, female patients, male patients. Let me walk you through this. If you have a negative MPI, so these are patients that have a negative test, diagnostic test. If you have a high chorus CAD, 60% of these patients with a negative non-invasive test actually have obstructive coronary disease. So you can do this test and reliably identify a patient population in 67% of cases that actually have obstructive coronary disease. On the other hand, if you've got a positive MPI, if you have a low score, you can reliably exclude patients that have negative disease. In 88% of the cases, only 12% will have false negative based on the low score. And you can see the rates in the male patient